Hi, everyone. I am Cynthia Charles, Vice President of Communications and Public Relations for the North Carolina Healthcare Association. I want to welcome you to our town hall today, which is the fourth in a series of town halls that the Healthcare Association is hosting around the state. And these activities provide an opportunity for healthcare leaders to have candid conversations with you, members of the public, to talk to you about what they're seeing in their hospitals, what they've learned from COVID-19, and some of the things that they are working on to make healthcare work better for you. All lines will be muted during the conversation today. If you have any technical issues or questions you'd like to ask, please use the question panel. You'll see that located on your control panel. And you can ask a question anytime and we will be monitoring it. And now I'd like to introduce you to our moderator, Jim Longworth. Jim is an award-winning broadcaster who has a long-running public affairs show in the Piedmont Triad region of the state called Triad Today. Jim is a great event host and interviewer, has a lot of television interview experience, and we're really fortunate to have him with us as our moderator today. So Jim, take it away, and thank you all for coming to our town hall conversation today.
Thanks, Cynthia, and hello, everyone. I'm really honored to be here to do this. Before we get going, let me remind you of a few things. First of all, just to go back over this is brought to you by the North Carolina Healthcare Association. NCHA is an advocacy organization that works with 130 member hospitals and health systems to improve the health of North Carolinians and the communities in which they live. Now, it does this by advocating for sound public policies and collaborative partnerships so that high quality health care can be made more equitable and accessible to everyone in our state. As Cynthia mentioned, these virtual town halls are designed to build relationships between North Carolina residents and hospitals and health systems that serve them. So toward that end, we hope that you did send your questions in as you registered, but if not, as Cynthia said, go ahead and click on that panel and you can submit one there. We also invite you to visit nchealthcare.org to learn more about what North Carolina health systems and hospitals are doing to respond to the coronavirus specifically and to improve the health care of everyone in the state. Please keep in mind, though, that the information being shared by our panelists during this virtual town hall should not be taken as medical advice. And so now let's introduce our panelists. John Gizdic is President and CEO of New Hanover Regional Medical Center. If you've kept up with the news, that's now part of the Novant Health family, and we welcome John. Dr. Philip Jackson is President of Sentara Albemarle Medical Center. His offices are headquartered in Elizabeth City, and we welcome Phil. He said I can call him Phil, so I'm going to do that. And then Dr. Michael Waldrum. Mike is CEO of Vidant Health, and we welcome all of you gentlemen. Thank you for doing this. Let's get to the questions, and we're going to get to some audience questions later on. Now, the state, North Carolina, has already administered over 1 million vaccinations. There's a plan to vaccinate, as I think, another 1 million just in the eastern part of the state in the coming months. So let's talk a little bit about how the rollouts are going with your hospitals. And Mike, maybe start with you. I understand that you guys are partnered with Pitt County in some way. Give me some updates, Mike.
Yeah, well, first, it's appreciate the opportunity. It's really an exciting time in the pandemic, and so we have this new, frankly, a fire hose to help put out the house fire that's COVID that's burning across eastern North Carolina. And we're excited about having that capability come to eastern North Carolina. But I also want to remind everyone that despite that, there's a large amount of virus in our communities, and we all need to do what we know is the right thing to do. Don't gather, wear a mask, and prevent the spread. And we'll get into this, but variants and the vaccine work better if there's less virus in the community. So we all have to, and we're in the fourth quarter, we hope, and this is the time to really be hyper vigilant. And so we're just excited about that. We're excited about our plan. We have network capability across our region with our clinics and a hospital. So we're giving vaccines in multiple locations. We have plans to do pop-up events in specific locations that don't have access and need to have vaccine brought to their communities. But we're really excited right now after a few weeks of running what we call our high throughput vaccine clinic, which is really part of our long-term plan as those other two elements, because we think we're going to be in the vaccine business for a long time. And so having a constant, steady, highly reliable vaccine venue has been going really well. We did it with partnership with the Pitt County Commissioner, Pitt County Health Department, ECU, and so many different collaborators. And I'll just tell you, the fun thing for all of us in this right now is that we do have this new fire hose. And so the energy is high and we're really providing a really important service. And then lastly, I'll just say, and we're concentrating, which we'll get into, in building all of those systems and processes to drive equity and make sure we use this vaccine for its highest best use, and where the pandemic has affected people in a not equal way, and we want to make sure that we address those issues as we do this work.
Right, and we're going to get into some of that a little bit later on. John, I hear that New Hanover has also leveraged some unique sites for distributing vaccinations.
Yeah, and so as Mike said, I just appreciate the opportunity to be here today and really have this conversation across Eastern North Carolina. You know, and here in Wilmington, we reopened our local movie theater, not because of all the movies coming out, but you can actually now get your COVID vaccine in our local movie theater. And, you know, we didn't really think about it until recently, but movie theaters are set up for a perfect vaccination site. They have a huge amount of parking. They have a huge lobby. They actually have great Wi-Fi if you've ever been to the movie theater, and you know, to connect all of our computer systems to, and they have a lot of chairs that people can recover in. And so we've been fortunate to partner with Stone Theaters here locally and are able to vaccinate over 1,500 people a day just in that movie theater alone.
Wow. Phil, I'm curious, speak to the point about why it's important to have partnerships, to team up with the organizations, and I think in your case with the health department itself. Talk about that.
Absolutely, and I'm glad to be here also. We work very closely with the regional health department here. They've been instrumental in getting out into 7 different counties that they cover. We also have worked with our community clinics that are out there that are serving the underinsured or uninsured. We've worked through with food banks, with our educational institutions here. All of them have come together to partner so that we're able to actually get out to a variety of areas in the communities and in the counties. As far as going out to, you know, fisheries where the migrant workers are at. This past week, we vaccinated an African-American woman that was 107 years old. And just being able to reach out and try to get to everyone, especially those in the underserved areas.
Let me ask Mike, this is a question I guess is the #1 question that we seem to hear around the state. Are the vaccines that are out there now safe, Mike?
Yeah, they're highly safe, highly effective vaccine. It's really exciting time. And it's interesting because I think that if you look at the acceptance of vaccines in our different groups, probably we all have a common experience with this. Our physicians are the most likely to be vaccinated. And if you think about that, they understand the scientific method, they understand the science, and they understand the literature around how effective and safe these are. And so actually, when we talk about 95% for the 2 that are out there, it actually underrepresents how safe they are. Because if you really look at even the people that were infected after they got the vaccine, so that 5%, only 1 person out of 40,000 people had to go to the hospital. So it protects you from getting sick and needing to be in the hospital. And that's a really important thing. As we all could tell you, we have a high death rate, and the burden of this disease is devastating to a significant group of people that get infected. So it's really safe and effective.
Yeah, Jim, could I just add that there are independent patient monitoring boards out there that are monitoring this actively day by day. There's opportunities for anyone to that's gotten the vaccine to provide input to these monitoring boards, and so we're constantly getting feedback on how well these vaccines are being taken and stuff. So just wanted to add that to what Mike said.
And Jim, this is John. To just piggyback on Mike and Phil's comments, but also going back to what Phil said earlier, this is one of our biggest challenges, is what you just hit on, is from a healthcare perspective, we know the vaccine's safe, but it's about building trust in our communities, and especially those underserved and underrepresented communities, and making sure that we're providing that education and engaging those communities where they are, not where we are, and making sure that we get that information out there so that more people are likely to want to get the vaccine. And I think that's an important challenge that we face as healthcare providers, but that we're facing as a state in general.
John, while I have you there, you want to just recap for us, or anybody can do this, I guess, recap for us who is currently eligible? Who are the folks at the top of the list to get vaccines? That's assuming that they are available, and more are being produced every day. But who's at the top of the list? Who are the priority groups?
Yeah, I'll start, and certainly Mike and Phil can chime in, because it changes fairly frequently, which is one of the challenges in keeping up with that. But obviously we started with our frontline healthcare heroes, right? And started with our staffs and making sure that our providers and our frontline staff were vaccinated. So at this point, all healthcare workers are eligible for the vaccine. And as Mike said, we've seen a tremendous uptake in that acceptance among our staff. Over 90% of our medical staff has received the vaccine. I think over 2/3 of our entire staff has received the vaccine, not just our clinical staff, but of everyone. And so that was the initial place that we all started. And then as the state rules kind of changed, we certainly modified with that. And so I believe right now it's 65 and above that are eligible.
Yeah, and Jim, I participate on the advisory group that helps create. It's a large group, but it has been deliberating this for a long period of time, and helps guide this at a state level. And I think that it's really important when we talk about what groups, to understand the intention of why the intention of the vaccine right now. So if we had an unlimited supply of vaccine, we'd want to vaccinate as many people as we could to get herd immunity. That would be the objective, but we don't have that. Right. And so the analogy that I made a little earlier, right? We have a house fire, and then we have the fire hose. Well, we want to use the fire hose where the people are sleeping in the bedroom. So with the highest risk people that are going to die or going to need healthcare resources. And so right now, the people that get this sick the most are over 65. And so that's why it is 65 and older. It's not that other people aren't important, but if we really want to protect people that are getting sick and dying from this, that's the group with this limited supply of vaccine. And so that's the intention.
Phil, John was talking about, healthcare workers getting these vaccinations. This is a little off script. We didn't really plan to go into this, but Philip, I'm just curious. Are you planning to mandate, or have you mandated that all of your employees get the vaccine?
Phil.
No, I think the word that we would like to use is encourage. I think we offer encouragement. Can't mandate it. It's the right thing to do. And for me, I set the example. I was out there in the forefront of making sure that I got it. But no, we cannot mandate it, but we certainly encourage, and we share updates with our staff. We have huddles in the morning to sort of let everyone know where we're at. And so I think that's probably about as far as we can take it for right now. And I think there's still probably some out there that are waiting to see, what's going to happen, what the reactions are. They're taking more of a wait and see approach, but I'll let John or Mike feed on to that if they want to, if they have something a little different around mandating staff.
Yeah,
No, Phil,
I mean,
John, I completely agree with you on mandating or not mandating at this point. But I think the great news is we haven't had to, right? Go back to 90% of my medical staff has already been vaccinated, and over 2/3 of my entire staff have already received the vaccine. And, and that's the great thing about those who work in healthcare, right? They lead the way and they're setting the example. And so, we're seeing that tremendous uptake. But also, as Phil said, while there is tremendous data out there, there are still some folks who are taking that wait and see approach. And I think at this point, that's okay. And with over 2/3 of our staff vaccinated, I think that really starts to set the bar pretty high.
okay. Let me shift to the pandemic in general. The governor, of course, is continuing to extend some variation of stay-at-home orders. Some hospitals around the country have postponed elective procedures. I guess the question for all of you, or anybody who wants to jump in, are you seeing patients, seeing a trend toward patients wanting not to have procedures, or maybe skipping healthcare treatments that they should be getting? Are you concerned about that at all?
Yes.
Yeah, I think we're all concerned about it. We know the literature. People are deferring needed care because of fear of COVID in healthcare settings, and I think we would all say we have highly safe environments. We've got experience with that, and we understand how to create safe environments for our team members as well as our patients. And we know through the data that there is this other epidemic called untreated chronic disease. And so if you look at the literature, it's clear that we've measured the deaths of COVID, but then there's an add-on to that from people that have deferred needed care. And so it's a very serious problem. I think we're all at a place where we think we can provide care for the patient that needs to care for their non-COVID issues, and we provide care for their COVID issues.
Phil or John, you want to jump in on that?
No, I would echo. Go ahead, John.
I'd say I completely agree with Mike, and I really think this is the other public health epidemic that we're facing right now. Is this putting off care, afraid to seek care, or delaying that care? And Mike's right. We're probably seeing as many or more deaths in that population than we are the COVID population. And so, I know we're all working as a field to try to communicate to the public about not delaying that care. And one of the safest places you can be is in a hospital. I mean, we have, sterile environments. And as Mike said, we've gotten very good at how to make sure we've got a very clean, very safe place for our communities to come receive care. And so this is a really important topic that we need to be talking about in addition to the COVID pandemic, to make sure people aren't delaying that care.
And Phil, you were shaking your head. Yes, Phil. What did you want to say?
Well, no, when John said, talking about the hospital being safe, I think that was a major concern for a lot of people, not wanting to come to the hospital because they didn't feel it was safe. And as I meet people out in the community and talk to them, they'll actually ask the question, is it safe to come to the hospital? They know that we have patients in the hospital that are COVID-19 patients, but so they're wanting to know, is it safe to come? Is our ED safe? And so we go through extended efforts of reassuring them that we are safe. I mean, the things that we do, we advertise in the newspaper, we on radio broadcasts, we talk about the fact that it's safe to come and get your care. Don't delay your care.
And very quickly, guys, give me your response to this. Since you brought up employees, staff, healthcare workers, what are you guys each doing to support your staff? And that support can mean many things.
Maybe I'll start. I would say, first as a physician and healthcare administrator, I think it's hard to even measure the amount of pressure and toll on our team members, our physicians, and our staff in trying to care for people that, as we mentioned, care for people every day, but then with this really incredible pressure, and then the fact that we've had to limit visiting hours and other things that are things we don't want to do that actually undermine our purpose of caring. And so it's just been a really hard time. And so I think, one, just affirming that. And then the list is so broad and deep, but actually it's not enough. And so new in communication forums, new avenues for relaxation inside the hospital, you name it. I mean, there's just so many of these different things of support, counseling, and all I would say is, despite all of that, is you can't communicate enough, you can't love enough, and you can't care enough. So it's just not enough. And so I think respecting and understanding and respecting those people by protecting yourself so you don't have to come and utilize the services is really the way we can all act. But it's just a really important topic.
I would add to what Mike said. I think one of the things that I felt very grateful about is actually the community caring. We actually had a big celebration here where the police department came out, the fire department came out, the Coast Guard was flying above in helicopters, the mayors, everyone came out to celebrate the heroes at the hospital. And I'm sure that that's true at other locations. But, the community's gone at great lengths to share their appreciation, show how much they care. I mean, I don't know how many times during the first part of this pandemic that we were getting free lunches and snacks and donuts, and I think we were all gaining weight at that point because there was just so much caring and compassion out there for what we were doing. So not only internally, like what Michael was talking about, but also externally from our community, showing how much they care.
John?
Yeah, I mean, just to echo what both Mike and Phil said. I mean, when you think about it, these folks are on the front line of this pandemic every single day. They are putting the community's needs ahead of their own personal needs. And so, as Mike said, nothing we can do for them can say thank you enough. And if there's any silver lining in the COVID pandemic, I think it's the fact that the world has now recognized who the true heroes are in our society. And it's frontline healthcare workers, but certainly all of the resiliency things that Phil and Mike mentioned. I mean, free food is always a great thing. The community support has been just tremendous, but also the financial toll this has taken. Many of our workers' spouses lost their jobs, with high unemployment. And so, we started an emergency response fund, and we all contributed to that to help them make rent, to help them pay bills, and to be able to keep, their life going as their loved ones have lost their job throughout this. I think the other piece that we certainly focus on our frontline workers, as we should, but let's not forget about the thousands of workers that we all now have working remotely that never worked from home before or worked remotely, and the social isolation that they're feeling. They're not able to connect with their team like they used to. And so we really have to go above and beyond and be intentional about those efforts to connect our staff as well.
I want to get into a couple issues of health equity before we go to the audience questions, because they may pertain to this as well. But we have a few minutes before we get to audience questions. In general, gentlemen, what are your hospitals doing to reach Black, Hispanic, rural communities with regards to vaccines and educating folks about COVID-19, the whole thing?
You want me to start again, and we'll keep an order here. I think that one, building on relationships and community engagement on so many different levels. And so it's really been a very positive thing, I think, and hopefully will endure post the pandemic, because it's opened up channels that frankly needed to be opened. And so educating with videos and chat sessions and different forums with so many different community groups, and then to build to build on that, access to the resource vaccines. And so systematically making those different relationships, connections, faith-based organizations, community-based organizations, and then partners in health departments and things like that. So it's really just been this massive collaborative effort of bringing different people together to build those channels, and then making sure you have systems and processes that allow people to have access to the vaccine. And so it's really been great work. And then pop-ups, as I mentioned, there's just a lot of different things that it takes time. But back to actually the comment that we had before, you know, frankly, all the the folks we represent in healthcare and ourselves, you know, we've only been in the vaccination game here for a pretty short order, and we were given a very short notice. You guys, you know, go vaccinate your communities. And so it's been this, and we didn't hire a bunch of new staff to do that. And so it's just been all of us running as fast as we can to do something we think is really important and make sure that we have equity at the very center of that. And I think all of us have done a really incredible job, especially because I know both Phil and John, we've talked about it, and we know we live in Eastern North Carolina. And so it's, you know, you got to know your environment, you got to know the people in your environment, and you got to connect them to the resources to allow them to get it.
Right. And Phil, I understand you set up a pretty good relationship working with faith-based leaders. Is that right?
Yeah, I think one of the venues that we use calls. We have calls with the community. We've done that with local providers. We partner with Vidant, that's here in the area. We partner with other providers, and we bring faith-based leaders on the call. We bring other community leaders on the call, and we share updates on what's going on with our vaccine programs, our vaccine clinics. We've worked very, very closely with the community health center, as I've mentioned previously, and that allows us to reach out to the underinsured and uninsured. It also allows us to reach out to the migrant workers. I've actually, probably in the last month, on a couple of occasions, have met with leadership from the 100 Black men and sat down and talked to them because they had a strong desire and interest in wanting to make sure that the African American community would get vaccinated. There were concerns about whether or not they would be afraid to, you know, get the vaccine and stuff. And so, you know, what I had committed to is making sure that they knew when these vaccine clinics were going to occur by reaching out to them and sharing with them. And so, you know, we've used different venues. We've met with, you know, Catholic leaders, which have led us to hit the Hispanic population, making sure that we're able to vaccinate them. So there are several venues very similar to some of the things Michael's doing, and I'm sure what John will share also.
John, as you jump in here, can you also sort of address the issue of how these things you guys are doing, these programs and strategies and initiatives to address health equity, how are they the kind of things that will survive after the pandemic, so that there'll be an ongoing thing and people won't feel like that, well, we've been abandoned now, we're past the pandemic, we get into next year? And what about these partnerships, John?
Yeah, that is a fantastic question, because that is what we have to ensure happens, right? I mean, I don't have a whole lot to add to what Mike and Phil had to say as far as the activities. To me, it really starts to get at, Jim, what your question is we have to be intentional about what we're doing, right? I mean, if you think about right now, the populations that are eligible, over 65, and we're talking about historically underserved communities, the African-American community, the Spanish-speaking community, and all the methods that we typically use create unintentional barriers. Well, you can schedule your appointment online. Well, those are the populations that don't have internet access. It's all in English. We have nothing in Spanish. I mean, and so we have to really step back and not just think about our traditional approaches to doing this. And I think we also have to challenge ourselves. I will tell you, here at New Hanover Regional Medical Center, we set a goal by March 21st. Our vaccination efforts need to represent the population that we serve, meaning all of those percentages who's getting the vaccine has to mirror our community population. And so we're going to be very intentional about that. And I think then, to your question, it really is about changing that mindset. We've all been working on and talking about health equity for a number of years now, but it's gone from maybe theoretical or abstract to reality. This pandemic has shown us what inequity looks like, and the fact that there are populations that are adversely impacted in many ways. And so there's no more is it, isn't it, does it, doesn't. We have the evidence. And I think, again, maybe the only other silver lining of the pandemic is shining a light on health equity, and therefore us being able to target those efforts and make sure around those lessons learned, and we sustain those in other areas after the pandemic is over.
And of course, collaterally, if we get everybody vaccinated and we can win this battle, that then helps to turn the economy around, which helps to eliminate some of the barriers that we are faced through this health equity dilemma. So,
Jim, I'd like to jump in real quickly, because I really appreciate the dialogue and think it's so important. And I think we have such a great opportunity to talk to a large group of people here that are listening. And one of the things that potentially can undermine equity activity is people that want to jump in line or rush to get vaccinated that don't meet the criteria or not follow the rules. And those are the things that actually lead to inequities. And I think that what we need everyone to understand is this is going to be a multi-month thing, and that we need to follow. The state has equity at the center of their activities. We're part of that plan, and we all are trying to do that. But if you read in the paper in other states and sometimes in our own, people call it the vaccine Hunger Games. And people need to understand that there's science and reason around these groups and why we're doing it the way we're doing it, but it's primarily around having equity, and we need the population in our communities to understand that and not attack actually the people that are trying to do that. So it's really an important topic. Right.
Guys, I'd like to look at some notes here from actual questions that were sent in when people registered. And as Mike alluded, we have a huge group watching. And this is not directed at anybody specifically, so anybody can jump in. I hope I pronounced this right. Gerani Berger from Access East asked about what's the current state of COVID-19 surge capacity, and are we past the surge expected from the holidays? Anybody want to take that?
I'll start, because Access East is such an important part of what we do. So thank you for the question, and thank you for being part of a really important fabric of how we take care of Eastern North Carolina. Access East is a really important organization. So thanks for that. I think we're all hopeful that we're past the surge, so we're all seeing numbers go down, but I can't, we're seeing them from a really kind of really hard phase. We still have 10% of our capacity being utilized for COVID patients. And although the percent rate and the number of cases is down, it's still way, way too high. I mean, 10%, 12% positivity rates means there's a lot of virus out there. And so that risk is there. And so we're hopeful that we're over that capacity issue. But we still have the unknown issue, which is the variant issue, which could totally change that.
And we'll see what Super Bowl parties bring in the next few weeks.
Yeah, and golly, I mean, what about that whole thing with the? I know people may not follow. Some people may not follow sports, but how stupid it was that we had athletes going out and wearing no mask and partying with other people that didn't wear masks. And people say it's disappointing that the games were canceled. Well, it's really disappointing that people didn't use their head. So I don't know. You're right, John. We'll have to see what happens. Charles Bangley has a question, and maybe Mike and Phil can address this. What actions can we work together on to help improve the health baseline of at-risk groups in our communities? Phil,
Yeah, I'll start. I think one thing that I think that we could do, here when I think about my hospital is, we have a community advisory board that has leaders from across the community. We have government officials, county officials, city officials on it, and I think that really serves as a great mechanism for us to be able to make sure that we are leveraging what we do in those meetings instead of getting together and going over maybe how well the hospital is doing. Maybe we should be looking at how well is our community doing. I think we do these biannual health assessments that really offer us a lot of insight into what some of the health issues are throughout our communities and throughout the counties. And so I think we have baseline data that tells us, that can point us toward where we should consider putting our resources to reach out and help the communities.
Mike?
Yeah, I'd echo all of that. The community needs assessment, really important. I think, again, we've built new and I think hopefully enduring channels to really deal with population health issues and the issues that are the social determinants of health that really dictate 80% of the health outcomes. So it's about the education system, jobs, and healthcare, and healthy habits. And so I think having dialogue around all of that. And then lastly, I would just say that we need all of our citizens covered with insurance. The Medicaid coverage gap in North Carolina is an issue. It affects people in our environments more than it does in urban environments, and people deserve to be covered.
Yeah, and we didn't rehearse this or anything, but I'm just, John or anybody, I'm just curious, based on what Mike just said, aren't we expecting another rollout or extension of Affordable Care Act coming out? I mean, how's that going to work in terms of trying to get more people insured?
Yeah, I think that's probably the several billion-dollar question, both at the state and federal level. At the state level, as Mike mentioned, it's really around Medicaid expansion and making sure that we get more North Carolinians access to coverage so they don't delay that care and they can get the care they need. Access is one of the biggest issues around health equity and the social determinants of health. And access these days is really related to coverage. And so, in North Carolina, it's around Medicaid expansion and making sure that we can move that forward. For us in the field, this is not a political issue. This is about the health of North Carolinians and getting them the access to the care they need. It should not be acceptable to anybody in this state that we rank 36th in overall health status out of 50 states. That is an embarrassment for all of us. And access and coverage is a huge part of that. And then, at the federal level, certainly with what may happen around the Affordable Care Act and everything going on there, unfortunately, has led to politicizing the health system, the general health system, and again, has impacted people's access to coverage and to care when we really need to be moving in the direction of ensuring more people have that coverage and the access to the care they need, removing those barriers that prevent them from seeking care.
Jim,
yeah,
you said we didn't rehearse this, and we didn't, but I think that, we do have a large group on this call, and I think it's important to talk about Medicaid expansion because it really is a fundamental issue. We're one of the vast minority of states that hasn't done Medicaid expansion. And people that think that this is rational from a financial perspective are not looking at how healthcare is really financed. The fact is that there is no free care. We are covering the costs of North Carolinians that aren't covered today, just very inefficiently through a hidden tax. And so I hate taxes, so I tend to be more on the conservative side. I hate taxes, but what I hate more than anything is hidden taxes, and that's what we have. And then, frankly, the sad reality is, because we're a minority in the states that have not done this, our federal tax dollars are funding New York and other states for their citizens to be covered. So it is time for us to take care of our own people. And if the pandemic hasn't demonstrated that, then I don't know what else will. And so as John said, this is not a political issue. This is smart business. It's good for our small businesses, and it's good for our people in our community. So it's time for us to do it.
Well, I hope that some state legislators just heard what you said, Mike, and if they didn't,
I'm sure they'll be told. I mean, they don't like me, you know, but I'm willing to have an objective conversation about it because
none of us like you, Mike, but no, but yeah,
I mean, I don't know you well enough yet.
That's right. But the association, you know, and we're having this this webinar today. I mean, this is a good way of getting the word out too. Before I forget, and I'm in one of those, you know, late 60s groups, so before my mind wanders, I think it was John that mentioned access. Guys, somebody jump in here and tell me, are we all engaged in offering some form of telemedicine? Is that working? Anybody?
Yeah, so I'll jump in. I mean, that again is another bright spot and lessons learned and what we've learned through the pandemic. You know, I can tell you, you know, here at New Hanover Regional Medical Center, last year alone, 2020, we went from about 300 televisits, you know, virtual visits in our primary care practice a year to 30,000 last year. Wow. And so really accelerating those efforts and ramping those up very quickly. But we also saw the community have a high level of receptivity to really engaging with virtual care and accepting that. And what really drove that was the payers finally stepping up and reimbursing for that virtual care. And so bringing that all together, it should be a great lesson in, you know, we all fought it. The payers fought it, the providers fought it for years. And when it came together, it was a beautiful thing for our community and our customers.
Who wants to, Phil?
Yeah, I would just add, you know, when I got here in 2019 and started learning about the community and some of the challenges that we have, you know, one of the goals that I set for myself is to increase access to care. And one of the leverage points for that was technology. And so I had sort of set that as a goal for the hospital to leverage technology. And I didn't know it was going to happen because of COVID-19 that we would get the results that we had. But similar to what John said, thousands and thousands and thousands of visits through telehealth. And you know, it really you know, our physicians and our providers became much more comfortable with the technology. And so now what we do when we get together and we meet, we talk to see how is that working now, you know, sort of things have settled down and we're doing both COVID-19 and we're seeing patients. How is that working now? Because we want to leverage this moment. I think we want to move forward and again, make this a permanent part of how we do business, especially in a rural area where you don't have, you know, I can't put a clinic up in every location. And I think there are challenges with bandwidth. You know, in some of the rural areas, but I think this is a great opportunity for being able to pilot projects, you know, maybe working with educational institutions, working with governmental institutions and getting them to try the technology. We've done that. They love it. They love being able to sit at their desk, you know, and close their door and take 10 minutes to jump on the phone with the provider, get that prescription refilled. You know, it really, I think they've all seen the benefit from it.
Mike, I want to get in a question from Annette Greer from East Carolina University. If you can take this for us, Mike, how can their question is, how can we identify and capture individuals who are at risk, high risk for mortality, but who don't fall into the current age group?
Great question. Thank you. Go Pirates. John has 2 sons that are Pirates. And I have to watch over them frequently when they're great question. I appreciate it. Actually, we're fortunate because we have a very comprehensive, large electronic health record that spans our region and is part of the backbone on telehealth. But in it, and ECU and Vidant are together on our electronic record. And so actually part of our equity work has already been to do this, take our patients and identify them through characteristics, either diseases, race, where they live, and those kind of things. So we've done it to geo mapping with ECU and Vidant, so knowing high-risk neighborhoods. And so we can identify people and then reach out to them and say, do you want to be vaccinated? And so that's when I talk about creating avenues and systems that actually take the highest risk people, in this case for COVID, and then navigating them to the right resource, which is in this case vaccine, which we're viewing with our work with ECU as part of our population health initiative. And so these lessons we can use for heart failure or diabetes and the other diseases, because Eastern North Carolina has a significant burden of disease with a lot of comorbid issues. And so that's how we do it, using our data infrastructure and geography, because it does affect different geographies and people differently. Great question, thank you.
Yeah.
I also think it points to the importance of having a primary care provider. And so that's another avenue that working with your primary care physician, they can help connect you with those resources as well. And so, as Mike said, it's both push and pull, right? And we can use the data and analytics from one direction, but also, each of us can take personal responsibility and make sure we have a primary care provider and make sure that we're getting access to the needed treatments through them as well.
This question comes to us from Melissa Venable with Atrium. And Melissa wants to know, what can the community do to help hospitals during the pandemic? We've touched on this a little bit in terms of partnerships, but maybe there's a different twist you can give on this answer, Mike or Phil, somebody?
Well, I'll start because I gave this some thought, while you were asking the question. And I think some of the basic things that we've been doing all along with the social distancing that's still there, and even if you've gotten the vaccine, that's not you can't use that for being able to now all of a sudden go out in crowds or not wear a mask. But the whole ideals around avoiding crowds. The governor has put a program into place. I think we need to abide by that program. You need to get vaccinated. That's the number one priority right now. And I know that we still have a ways to go. One of the things that I practice, and we all practice in healthcare, but everyone needs to do it, is hand washing. And making sure you're washing your hands, making sure you're wearing a mask. When you're coughing and sneezing, make sure you cover your nose, your face. These are all things that that CDC and others have been talking about for a while, and we just need to continue doing that. And when we go into businesses, the business leaders need to make sure when folks are coming into their stores that they're wearing a mask, and that that they're practicing safe habits also when we're going out there. So just some ideals. I'm sure Mike and John have others that.
Yeah, I totally agree. I would just say really patience, having patience. It's an incredible place we're in right now. And this is the largest mass vaccination effort in the history of the world. And we've never done it before. And these gentlemen and us, we've only been doing it now for 6 weeks. And so we had to build all this, and we had never done it. And so I think having understanding that we have this very limited supply and of the fire hose coming in, and we need the house fire to be as low as it can. If we want to have no variants and we want to get our economy and our lives back, the quickest way to do it is get the amount of virus in our community as low as we can and get vaccines out. And so we're going to need patience, and we got to bring those two things together. And so what I love about Eastern North Carolina is the sense of community. We've all talked about that. And I think that everybody in the community having that discussion and saying, do we want our lives back and how quickly? Well, that's what it's going to take, and a little bit of patience with each other.
And I'll pick up on Mike's comment about the sense of community in Eastern North Carolina. Totally agree with both of them. But the other thing we need is literally their help, as in volunteering to help us. Because as Mike said, we are 6 weeks into the largest mass vaccination in the history of the world, while we're caring for the highest record number of COVID inpatients that we've ever experienced. And that's only one pool of resources, and it's our staff. And they can't be in 2 places at one time. And right now, all of the support to care for inpatients and for vaccination has come from our staff. And so helping volunteer at our vaccination sites and helping us with logistics and things like that can really free up our staff to be administering the vaccines as well as caring for patients and really give us those extra resources and that sense of community that we have here in Eastern North Carolina to help all of this go even quicker.
One thing that I think is problematic, and I don't know whether you agree or not, but there's been a lot of misinformation out there over the past year about what to do. As we all recall, at first it was the main thing, folks, is don't touch any hard surfaces. The next thing was wear a mask now that the masks are available. The next thing, or actually before that, it was social distance yourself 6 feet. And then there were a number of experts who came out immediately after that or soon afterwards saying, no, we think it should be 10 feet. Now we're into the discussion about whether you should wear, are 2 masks better than 1, or is 1 mask better than another kind of mask? Guys, give me some, before we lose time here, I'd like to hear from each of you. What do we do about trying to get correct information out to people, and what should that source be?
Well, I'll
Yeah.
no, go ahead, Mike. I would say that because this is constantly changing, and like Michael said, that this is the first time in the world that we've ever, first time we've ever had to do anything like this. We have been constantly learning from the start of this. And so, I would say that there were things that were constantly changing as we went day to day. And I think it shows the level of adaptability and resilience of our leaders and our staff to be able to, wearing our mask, social distancing, can we reuse masks again? Because at one time there was a shortage. And so this continues to evolve over time. And I don't think we've reached a hard stop at this point. I think that you will continue to see new things come out, new guidelines come out, new direction given. And again, this is something that we're doing for the very first time. So, those are some of my thoughts.
Yeah. So I am a pulmonary critical care doctor who has a degree in epidemiology, and I run healthcare. And I'll tell you what, it's not. This is not a political discussion. And so don't look at political sites to get information. The virus doesn't care if you're Democrat, Republican, or independent, right? And so we're looking to the wrong sources for information. I would say look to the CDC for the best information, but it's evolving, as Philip said, and totally agree. And then lastly, I would say we know the answers, right? It's called common sense. We know respiratory viruses come out of your face and they get in the air. And so if you have something over your face, it's less likely to get out. And so we've known that before the pandemic. We've known it with other respiratory viruses. And so I think people want these hard rules, and then they want to show the one case where it didn't work. And it's not about absolute anything, right? It's about further away, better. Less people, better. Not more mask, better, so that we could get into the multiple mask, and that's a complex discussion. But just if everybody wore a mask, so more people wearing a mask, better. And so it's not about absolutisms. It's about relative risk and people using common sense around relative risk.
John, you want to give a final thought on that?
I will. I learned when you follow somebody who studied stuff I can't even pronounce or spell, you don't try to add anything to it. You just tell a story to distract a little bit. And You know, in Eastern North Carolina, unfortunately, one of the things we're very familiar with is hurricanes. And to me, this is much like a hurricane. It is a constantly evolving, very dynamic situation. And, you know, unfortunately, what I've learned in being through 14 hurricanes in the past several years I've been here is constant communication and building that trust and that rapport with your staff or with your community. As Mike said, it's really about getting the right information in the right places. And I think if we can build that trust and that education and continuously communicate, but recognize this is a constantly evolving situation that will be changing almost daily, hourly, and we're doing the best we can. We are here for our communities, just like we are in hurricanes and other situations. And so know that we've got your best interest at heart, and we're trying to make sure we get that best information out there.
Yeah, and I think I heard Phil say off camera that whenever Mike walks into a room, it's much like a hurricane. Guys, I want to, as we wrap this up, and this is something that we do this at the end of each webinar. I want to give each of you a minute to answer this question so we can know a little bit more about you, but maybe what motivates you. And the question is this: who or what led you to a career in healthcare? And let's start with Phil.
Well, I would probably go back to my childhood where, you know, the care that I received while I was growing up was not through a primary care doctor. You know, our family didn't have access to primary care. We sought our care by going to the health department, going to the emergency room. When I joined the military, I started working in healthcare. And that brought me closer to it. And at that point, I wasn't sure whether or not healthcare was going to be a career for me. But as I continued to grow in my education and leadership and being in hospitals and traveling around the world, you know, it became something that became a huge part of me. So, you know, healthcare is near and dear to me. I'm very passionate about it. It's a lifelong learning experience. It's dynamic, it's complex. There's no easy fix. And you know, I'm just very happy to be a part of something that means a lot to everyone.
John, same question. Who or what led you to a career in healthcare?
Yeah, you know, my story is much like Phil's. I'm the oldest living male in my family. And that is because of a lack of access to healthcare. Growing up, you know, in Western Pennsylvania, in a relatively poor area of Western Pennsylvania, and you know, my family spent a lot of time in the steel mill industry, which we all know all closed down. And so, you know, being unemployed and not having that access, you know, I saw my father and my grandfather and a lot of people die way too young because of that. And so, you know, just the opportunity to see the difference that it makes in families and individuals' lives that are cut short way too soon was kind of what opened my eyes to it. And then just getting the opportunity, you know, really through a guidance counselor in high school who connected me with a college roommate of his that was a healthcare administrator at the time. Because like Phil, I didn't know it was a thing. I just knew, you know, we didn't get to have access to all that stuff. And when I met him and learned it could be a career and that you could actually make a difference and have an impact like that, I was hooked. And so since my senior year in high school, and I won't say how many years later, here we are.
Mike, same question. Who or what led you to a career in healthcare?
Very similar themes to both Phil and John. Fundamentally, it came from my mother, who instilled in me that love for your fellow human is the most important thing. And so at age 13, I said I wanted to become a doctor and be in healthcare because I love people and I love helping people. And so it's what fuels me today. And there's no more important time than right now and a more important place than Eastern North Carolina right now to be doing that and us coming together to help each other. So it's a great career and a great life. And so thanks. Appreciate the opportunity to be on this.
Well, thank you. Actually, I want to thank all three of you for doing this. And just to mention you one more time, as people are looking in, we thank, of course, John Gizdic, President and CEO of New Hanover Regional Medical Center, Dr. Phil Jackson, President of Sentara Albemarle Medical Center, and you just heard from Dr. Mike Waldrum, CEO of Vidant Health. Now, I'd also like to thank all of you who took time to watch and participate in this webinar and send in your questions. If your question was not addressed, please send us an email to communications@ncha.org. ncha.org. Today's town hall has been recorded. It will be available, I'm told, for viewing or listening on www.nchealthcare.org. nchealthcare.org. Maybe not immediately, but soon hereafter. So please share that with your community. Well, I'm Jim Longworth, reminding you, as these gentlemen have, to wear your mask and social distance and wash your hands and all those things. And as soon as the vaccine is available to you and your group, please partake of that. For all of us here, I'm Jim Longworth. We'll see you next time.
Thanks, Jim.
Thank you.
Bye. Bye. Bye, everyone.
Thanks, guys.